How do you know if you are ovulating? Knowing when you are ovulating can be helpful in both preventing pregnancy and planning for it. Do you know when in your menstrual cycle you are ovulating? In this video, we tell you all about it. If you want to get pregnant, you need to learn how to figure out how your menstrual cycle works. Knowing if you are ovulating will increase your chances of conceiving because it is during the fertile days that the body has everything it needs for fertilization to take place. What are the symptoms of ovulation? At what point in the menstrual cycle does it happen? First, we will quickly review the characteristics of the normal menstrual cycle. Next, we'll take a look at when you ovulate and how to tell if you are ovulating. Have your period normally and ovulate. The normal menstrual cycle consists of a series of changes that a woman experiences when she reaches a fertile age. This cycle is done monthly and prepares her for the possibility of having a successful pregnancy. These changes are due to the presence of different female hormones. The level of the latter will increase or decrease in the blood, determining the different times of the cycle. Features of the menstrual cycle. These hormones are secreted in the brain, hypothalamus and pituitary gland, and the ovaries. In the majority of cases, the menstrual cycle has the following characteristics. It lasts between 28 and 35 days. This cycle is made up of two periods, the follicular phase and the luteinizing phase. Day number 1 is the first day of menstruation, and this is where the follicular phase begins. The follicular phase is the first period. It lasts between 14 and 21 days. It encompasses the entire period and ends at ovulation. The luteinizing phase is the second period. It lasts on average 14 days. Every month, ovulation occurs. During the normal menstrual cycle, changes will take place in the female body. Some of them include changes in body temperature, vaginal fluid, menstruation. Ovulation is the release of one or more eggs from the ovaries and occurs every month. The egg will stay for a short time while waiting to be fertilized by a sperm. Menstrual cycles vary from woman to woman and month to month. This variation occurs especially in the first phase, which is the follicular phase. As we have already mentioned, it is the one that includes ovulation. This is why calculating ovulation can be difficult. In this article, we'll look at how to tell if you're ovulating or not. There are also variations depending on what stage each woman goes through. During the first years of fertile age, the cycles will be longer, and then they will get shorter. We know that the greatest possibility of getting pregnant will be between 3 and 5 days before ovulation, or even on the day of ovulation. We, therefore, deduce that the possibility of determining this period, which we will call the fertile period, will maximize the possibilities of conception. How do you know if you are ovulating? The first thing we will say is that there are no reliable grandma methods for predicting the day of ovulation. Thus, predicting the fertile window will not be entirely reliable either, unless one is based on the identification of the hormonal changes that occur during this period. Note that keeping a calendar and counting the days to identify the fertile window is not a method that has proven to be reliable. As we said before, this period changes every month. On the other hand, the method of taking temperature is not reliable either. New mobile apps for estimating body temperature have appeared, but they have not been found to be 100% reliable. One method of identifying the fertile window that has proven to be more reliable is the identification of vaginal fluid before and during ovulation. We know that when a vaginal fluid increases in quantity or becomes clearer, more elastic, and slippery, it indicates a fertile period, which therefore includes the day of ovulation. There is also the possibility of calculating female hormones in urine, with a kit that looks like a pregnancy test. It is called an ovulation kit and is used to predict the fertile period. These kits are quite affordable in terms of price. However, they can give false positives. Consulting the gynecologist is important. Homemade methods of measuring vaginal temperature and fluid can be used to tell when you are ovulating, but they are not entirely reliable. These two methods are less effective than using ovulation kits, although it should be remembered that there are false positives. In case of doubt, it will always be better to consult a doctor or a gynecologist. So you can see what the different options are.